qual è la correlazione tra il deficit di vitamina D e il deficit cognitivo? Ne abbiamo parlato con Olivier Bochet, a capo del Dipartimento di Medicina Interna e Geriatria della città di Angers, nel nord-est della Francia, che qui a Genova, al congresso denominato Dimenzia, ha tenuto un'interessante relazione proprio su questo argomento. Ne parliamo con lui in lingua inglese, quindi insomma in un territorio neutro per entrambi. Allora, Olivier, first of all, why you have decided to study this type of correlation, so the correlation between vitamin D deficiency and cognitive decline?
Because at the beginning we look about the association between gut disorder and cognitive decline, and when we look the literature, we found that there is many publication about the vitamin D supplementation and the decrease of fall weight in older persons. So it means that vitamin D supplementation have an effect not only on bone but on extra bone effect. So we suppose that vitamin D may act on the neuromuscular system and cognition. And because we are also specialists on cognition and cognitive decline, we explore the association between vitamin D deficiency and cognitive decline.
Which are the international data about this type of correlation?
Yes, now we have many data in the literature. There are many meta-analyses who show that there is an association between low vitamin D concentration and cognitive decline in demented patients, and especially in Alzheimer's patients and in non-demented patients.
But there could be this type of correlation, but are you sure that there is a causal relationship? Or maybe it's something that happens because most of people, especially in the elderly, have vitamin D deficiency?
With observational data, it's very difficult to show a causal relationship. But now we have many data with cross-sectional study and longitudinal study. We underscore the fact that it's probably a causal relationship. If the beginning is a vitamin D deficiency, and this is a risk factor for dementia.
Okay, and in your center you have conducted a specific study to better explore this type of correlation. What you have found?
We find different results. First, we find that demented patients are more deficient than non-demented patients, like the previous publication in the literature. We also find that vitamin D deficiency is strongly associated with a particular cognitive decline, which is executive dysfunction, in fact.
What does it mean?
It's a kind of cognition aspect. We control the behavior of subject. And we underline the fact that vitamin D deficiency is particularly related to this executive function.
So we are sure, or almost sure, that in this type of patient with cognitive decline, so for example Alzheimer, there is a large vitamin D deficiency.
Yes.
Is this correct?
Yes, it's correct. And the deficiency is at the beginning of the dementia, an increase with the dementia, underlying the fact that it's probably a causal relationship.
And which could be the effect of this type of deficiency?
There is two kinds of effect on cognition, of course, and on behavior also, in fact, because vitamin D may act specifically on cognition and decrease your global cognitive performance, but also have a negative effect on your mood, on your on depression. So the two effects increase the cognitive decline of subjects with dementia.